In a year where our health has been the top priority and people have been more aware of what they're doing and the choices that are available to them, the first step in all of this is awareness. Equipping yourself with the right information is very, very important. And I don't mean the WhatsApp messages that keep circulating on our family groups or in our apartment groups. When it comes to the health, make sure you hear it from an expert. And in our bid to make sure that we get the correct information out to all our parents, we are talking to an expert. We have with us Dr Prasanth Inna. He's a consultant Paediatric Orthopaedic Surgeon at Manipal Hospital. And he's going to be talking to us about a lot of things of common orthopedic problems that children are facing currently.
Yeah, hi guys. Hi everyone.
Hi Dr. Inna. How are you?
Yeah, I'm fine. Thank you.
So to start off, the one question that we get a lot of questions about is the walking milestone. What age should my child be when, to start walking by? And if they don't start walking, when should I be worried? What is the age bracket that we're looking at?
Yeah. So basically, if you look at the upper age limit of walking for as milestones, 18 months is the upper age limit for walking without any support. And if you look at the development, girls develop faster than boys. So girls end up walking earlier than boys. Most of the kids would walk by 1 year, but if they don't walk by 1.5, that is when we say the development is delayed. The one more point that we need to consider is when the parents have been slow in certain aspects of their development, we need to give a little bit of leeway to the kids as well. The simple example being, if the parents have started talking very late in their lives, say they talked at 2.5 years, it's not uncommon for the kids also to start talking at 2.5 years. That doesn't mean the kids are abnormal, just that a part of the genetics is kicking in. So
I didn't realize that genetics was part of this as well.
The development, yes. So if you see, yes, 1.5 years is the upper limit for most normal kids, but we can wait till 2 years.
And when should we start panicking if the child does not start walking? I mean, what are you think between 1.5 to 2 years, but there must be some indication that, okay, there may be an issue here and we should not panic, or we should panic.
Yeah, okay. So basically, if you think the rest of the development also is slowed down, say the speaking is slowed down along with walking, the speaking is also slowed down, the social development, how the baby interacts with others, how friendly it gets with others, that development is also slowed down, then you have to worry, because it's a part of overall slowed development. It is not just a single bit that is slowed down. Rest of the stuff is also slowed down. That's bad. Second thing is, if you notice anything unusual in the way they do their things, like the way they pick up their stuff, the way they start standing, the way they start holding on to objects, if you feel the way they do these things are not as normal as other kids, then definitely you need to be worried. But I would suggest that if the walking hasn't started by 1.5 years, better to meet a doctor who can recognize it better, rather than parents having a self-diagnosis and waiting for more.
We totally agree. And that's one of the reasons why we wanted to have the live with you, because we wanted to get the right information from an expert. All of us are Google Babas everywhere. And we want to make sure we get the right information out to all our parents.
Yes.
Also, babies who start crawling, and there's some who start crawling and then graduate to walking. And there's some who do this half crawl and then they start walking automatically. Is that okay? Is that a milestone?
So there is a category of people called bottom shufflers. Now those bottom shufflers sit on the ground. They shuffle using their bums to move, but they don't come on all fours. And then they go stand and then they walk. So if you are looking at things which every child does, you have sitting, you have standing, you have walking. Walking on all fours, walking on 4 legs, crawling, what you call, is not something which every child does. So there will be some lazy bugs like me who will hoodwink that part of development and they'll make sure they just straight away go on to walk and stand. So in that way, crawling is not a necessary development. It's not a necessary development. So if they don't crawl, it's okay, as long as the rest of the development is within normal range. So sitting by 10 months, standing with support by 12 months, walking without support by 18 months. So that's fair enough.
We've seen that some kids walk funny, they wobble from side to side and walk. Is that normal in kids when they're learning to walk?
Now, when people start walking, so there's this funny way of walking is very variable. Now, parents say funny. For us, it is very tough to find out what they are saying unless they demonstrate well. So, when they start walking, yes, that's duck-like walking like this. That's called a waddling gait. That's quite common because the hip strength is not that good. So, initial way of walking, duck-like walking is okay. But a prolonged duck-like walking is not good. It either suggests some problem in the hip structure per se. Typically, the hip might be dislocated, which is not a good sign at all. Or secondly, more commonly, if there is a weakness of the muscles around the hip, what we call it as proximal myopathy. How to confuse people, you use very tough words. So proximal myopathy is the scientific word, but the common sense is the muscles around the hip are weak. And the commonest reason for that is vitamin D deficiency. Okay. So when that happens, they also tend to have a duck-like walk. So normally also you can have a duck-like walk. Abnormally with hip dislocations you can have it. With slight changes in the shape of the hip bones also you can have it. With general problems like vitamin D deficiency also you can have duck-like walking. So that should usually settle down. If it doesn't settle down, definitely you should meet a doctor. Now coming to your general, the question asked was a very general question like funny way of walking. Now that funny way of walking at birth, at walking age is usually a duck-like walking. At 1.5 years, it can be the duck-like walking because of the bowing of the legs. Later on, that odd way of walking can be because of the structural changes in the bones or because of the differences in the nerves, nerve strengths, or because of the muscle issues or the length issues. So there are so many issues that can happen. So it's rather a very vague terminology, but yes, at standing and walking, waddling gait can be normal.
That's great because you've given us a milestone, like an age thing. So we know that a parent would know that at this age, then I should start consulting somebody. Yeah. Thank you so much for being a part of this live.
Thank you. My pleasure. Yeah.
It's been a great session, and I think it's going to be beneficial for everybody.
Sure, ma'am. Yeah, thanks. Thanks for this, arranging all this. My pleasure.
Thank you so much.